Welcome back YouTubers to my channel of an everyday life of an Aspie. If you're new to my channel, I welcome you with open arms. I'm Aspie and I'm all about creating mental health awareness and sharing my life stories with Asperger's syndrome, OCD and the like, along with tips and advice along the way, as well as also the separate playlistings of the Beauty from Ashes by giving you guys words of encouragement and support any way I can. So it's been brought to my attention, as I said, to try and clearly tidy up what is left of my Tourette's syndrome series right now, so that it can be readily accessible for any of you that's of interest that wants to know about it. So hopefully some of this will be of value and use to you. And also to be in mind, also, as I say as a disclaimer, that I'm no medical doctor, I'm just your normal everyday Joe blog. So if you see any clinical signs and symptoms of anything of that matter that is described in any of these mental health disorders, what to look for, seek professional help or medical attention or advice for yourself or your loved ones, so that you don't forever condone self-harm. So this one's all about, as I said, Tourette's, and this one's basically hopefully broken into two parts of what I'm about to talk about, which is the tics as promised. So this one's going to be part 2 obviously, and this one's going to cover the treatments and when to call a doctor and whatnot, because in the very first one, just to cover up, is what is a tic, the types of tics, the categories of tics, the causes of tics, as well as the signs and symptoms of tics or what have you. So hopefully this is relevant and obviously being of use to you, and hopefully we're learning something along the way from each other. So let's begin this before I run out of time. As we know, basically when it comes down to it, for the first part we need to be addressed is when to call the doctor is a good question. Most cases for mild tics, however, doesn't require medical treatment and will clear up on their own over time. Doctors usually recommend that family members try to ignore the simple tics, since teasing or other unwanted attention may cause the tics to worsen. A visit to the doctor is recommended, however, under any of the following circumstances as follows. Number 1, the child is falling behind in schoolwork because of the tics. Number 2, the child's relationships with peers and adults outside family are affected by the tics. Number 3, the child cannot carry activities of daily living such as self-feeding, bathing, getting dressed, etc. Number 4, the child has fallen, injured himself or has developed some other physical problems because of the tics. Number 5 is other family members have or have had tic disorders in the past or present. Number 6, the child has recently had an episode of strep throat or any other streptococcal infection. Number 7 is the child has been diagnosed with OCD, ADHD or depression or any other form of mental health conditions. And last but not least, number 8 or 9, the tics have just come on suddenly. Right, for the treatments, however, as we know, basically there can be some treatments available, but it's well suited for the person that is going through it. Some people may say that they don't need treatment or medication or whatever, but this just depends on the person, however, what I'm about to address. And you know, as I said before, just to maybe, if you're that concerned, just seek professional help for yourself or your loved one. Treatment. After psychoanalysis was discredited in the 1970s as a treatment for tic disorders, some doctors has urged using such antipsychotic drugs such as haloperidol or Haldo, as known as for short, to treat TS by suppressing the tics. Okay, if you hear me breaking down some terms, TS will be your Tourette's syndrome, just to bear in mind, and some other bits and pieces, and I'll abbreviate more about what the other terms when you hear about it to get a better understanding as well as what they are. These drugs, which are sometimes called neuroleptics, have severe side effects and are likely to interact with other medications that the child may be taking. In addition, tics are increasingly recognized as complex phenomena that have an emotional as well as physical dimension. As a result, the treatment of tic disorders has recently changed as of in the early 2000s in the direction of minimizing the use of medications in favor of a multidisciplinary approach. The approach to access a child with a tic disorder is as follows to what I'm sharing with you all. Administer the YGTSS. You may be thinking, what the hell is this and how does this work? So this is abbreviated down to Yale Global Tic Severity Scale. This is to use in order to evaluate the areas of the child's function that are most severely affected by the tics. Then what they do is, here how it works, they'll identify any comorbid disorders that is present. In many cases, the tics don't interfere with the child's life, such as ADHD, OCD, depression, and the like. ADHD, however, should be the primary target of the management in children diagnosed with the tic disorder and comorbid ADHD. What it then does after this will rank the symptoms in order of importance in order to focus treatment on the ones that are most significant to the child and the family. And then for this is they emphasize controlling the tics and learning to live with them rather than trying to eliminate them with drugs. Using behavioral and psychotherapeutic approaches as well as medications maybe involve the patients, teachers and other significant adults as well as parents in order to help monitor the child's symptoms and response to any treatment whatsoever. Medications. As I said before, there is no medication that can cause a tic disorder just like that by the snap of the fingers, but as we all wish for most mental health disorders, wouldn't it be great for it to disappear? But then again, we shouldn't be complaining. All the drugs that are used to treat these disorders as of the early 2000s are used only to manage tics. In general, doctors prefer to avoid medications in treating mild tics. Start the treatment on moderate or severe tics with medications that have relatively few side effects and prescribe stronger drugs only if necessary. Children whose throat cultures or blood tests are positive for the GABHS infection strain are treated aggressively with antibiotics, or most commonly penicillin 5. Psychotherapy. Psychotherapy for tics and tics disorders alike typically involves education about tic disorders and therapy for the family as well as the individual treatment for the child. The American Academy of Child and Adolescent Psychiatry, or AACAP, urges parents to avoid blaming or punishing the child for their tics, as a shaming or harsh treatment may increase the child's level of emotional distress and usually will make the tics worsen. Cognitive behavioural approaches have been the most common type of individual psychotherapy, however, that is used to treat tics and tic disorders. Specific behavioural approaches include the following: mass negative practice. In this form of behavioural treatment, the child is asked to perform the tic intentionally for specific periods of time, interspersed with rest periods, completing response training. This is a form of treatment on motor tics in which the child is taught to make the opposite movement of the tic. Self-monitoring. In awareness training, the child keeps a diary, small notebook, or wrist counter for recording tics. It is supposed to reduce the frequency of tic bouts by increasing the child's awareness of them. Contingency management. This approach works best in the home and is usually carried out by the parents. The child is praised or rewarded for not performing the tics and for replacing them with acceptable alternate behaviours. As of the early 2000s, however, no controlled studies have been done to compare any of the effectiveness of these various behavioural approaches. At best, they appear to produce mixed results, however, just to bear in mind. Surgery. Surgery is used very rarely to treat tic disorders. It is usually tried only if the tic has not responded to any form of medication and that it interferes significantly with the patient's life. Some patients with TS, however, have been successfully treated with stereotactic surgery, which involves high-frequency stimulation of the thalamus. Stereotactic surgery involves an approach that calculates angles and distances from the outside of the patient's skull to locate very small lesions or structures deep inside the brain. This will allow the surgeon to remove any tissue or treat injured areas through that much smaller incision. Alternative treatments. The place for alternative or complementary therapies in treating tics is debated here, however, for this. One group of Chinese physicians reported successfully treating patients diagnosed with TS with acupuncture. However, a group of researchers studying traditional medicine in Bali found it ineffective in treating tic disorders. And a second group of St. Johns Hopkins reported that relaxation therapy did not have statistically significant effect in treating children diagnosed with TS. Therefore, there is also some evidence that ginkgo, ginseng, and some other herbs that may be taken for their stimulant effects may increase the severity of tics in children and adolescents alone. There has been some nutritional concerns, however. Although some nutritionists may have suggested a possible connection between sugar or food colouring and tic severity, no studies has been published as of 2004 has demonstrated this connection, however. One study has been done at the University of Kansas that did find a connection between caffeine, which is found in popular beverages and some other soft drinks, as well as tea and coffee consumption and tic severity in children. The study sample, however, was quite small. Well, this basically ends the last part of what is a tic, or the introduction of the tic, part 2. Give me that thumbs up for support, comment below if I've missed out anything, or just comment below if there's any bits that I may have missed that may be of relevance for the ones that do suffer from the tics, and maybe tell us about the treatments or whatever that flows into this discussion. I'm leaving this for the discussion board right now. Feel free to subscribe to my channel if you haven't done so, because I do this on the daily. Don't forget to put the notification bell on, because you'll need to know what Aspie's up to so you can keep up to date and informed when she's uploading her videos. So if you're still interested in some of these or more videos that I'm going to bring out sooner or later, feel free to share these videos around to your family and friends. Follow me on my social media sites that is listed below. Feel free to also comment if need be, or shall we say private message me on my social media site of AspieAnswersAll, or even just on here on YouTube if you need someone to do just a topic to throw at me, whatever it may be. And all further ado, guys, thanks for your support, thanks for watching. Do what you love what you do. Until next time, Aspie signing out, and I'll see you all again soon. Ciao for now.